Chris Hayes here from Hayes Physical Therapy in Bayonne, Pennsylvania. If you have a herniated disc in your lumbar spine, there are definitely things that you should do and things that you should not do. So the very first thing is, if you have a herniated disc and you're getting pain that's going off to the right or the left, the first exercise that I'm going to give you is to actually put a beach towel on the side that you're having symptoms. That actually helps to push the disc material a little bit more towards the midline, which should relieve some symptoms that you might be experiencing down the leg. Our goal with the herniated disc is to try to prevent any more herniation from exiting out on the nerve root. That's what's causing the pain that you experience down the leg, and it is painful. So the very first thing is, assuming that Tyler has pain going down his right leg, we're going to put a rolled up beach towel and we're going to actually put it on his side, and he's going to lie down over that beach towel and take some out of gravity and put your whole head down, Tyler, and relax. And we want that beach towel to be even front to back. Good. And so what's happening right now, whether his legs are straight or whether his legs are bent, is totally fine. But right now, this little beach towel is putting pressure on the disc to actually push it away from the nerve root. And so in this position, we want you to kind of be bowed over that area, which he is, with that beach towel. Relax your head and just hang out here. So typically a side lying stretch here with the beach towel for about 5 minutes, okay? That's exercise number 1. So Tyler, come back up to sitting for me for a moment. Second exercise is I'm going to actually have him go down on his stomach, flat. Let your legs hang over the edge, good, and lie flat for me. Put your head down, put your hands in the center there, and put your forehead on your hands. Right in the center, like so. Good. Right now, his back is going into a tiny bit of an arch, right? That's another direction we want with a herniated disc. We do not want you to bring your knees to your chest or do anything that's going to involve bending. Progressive extension is the way to go. So he would lie here for about a minute or 2. If it was too uncomfortable, he would put a pillow under his belly to reduce the arch. After a minute or 2 in lying, then I'm going to ask Tyler to prop up on your elbows, Tyler, like you're reading a book. And you'll see that this gives much more of an arch to the low back. And again, if it was too aggressive, you put a pillow underneath your belly so it will reduce some of this. Typically in our practice, we'll say if you can stay here 2 to 5 minutes, that is great. So again, putting pressure on that disc, it should help to relieve some of the symptoms, draw the symptoms out of the leg up towards the spine. That's the direction that we're going. That's called centralization of a herniated disc. If it's going further down the leg, it's too aggressive, and that's the wrong direction. That's a red light. So that's the second exercise after the sideline with the pillow. The third exercise, if it's okay, is going to be, Tyler, go back down flat for a minute. We're going to do a press up. So arms are going to be down here, elbows in the air, and then he's going to slowly just come up, increasing his arch, stopping if he has any discomfort. 1 breath, and then right back down. And then he'll take that one more time. Again, you can see it's a lot more arching. It's okay if the symptoms feel a little worse in the back, so long as it's drawing up the leg. That's a green light, okay? So that is a prone press up. And then lastly, I'm going to give you one more for the bonus. Come up to standing for me, Tyler. And we're going to do just some healthy back extension, small range, just extending back and forth. These are all extension exercises. The right thing to do for a herniated disc. Do not bring your knees to your chest. Even though it might feel better to do so, it's going to make that symptom much, much worse, delay your healing. Overall, if you have a herniated disc, it really is something that you should be under the care of a physical therapy practice such as ours, because things change and it's important to have that kind of guidance so you're not doing the wrong thing and you're moving in the right direction. Thanks so much.